16-year-old Shaurya Patil from one of the city's most prestigious schools walked out of a bad day at school, took the back exit, went straight to a Delhi metro station, climbed up to an overground platform and jumped to his death.
Hello, I'm Dr. Abhinav. I'm a psychiatrist. And today I'll be talking about teen suicides in India beyond one cause. Now, teen suicide is one of the most uncomfortable conversations we have as a society. Not because it is rare, but because it forces us to confront how complex adolescent mental health really is. In India, suicide is among the leading causes of deaths in adolescents and young adults, as reported by the National Crime Bureau. These are not just numbers, these are children, families, and futures. One important clarification is that teen suicide does not happen because of a single reason. Not exams alone, not social media alone, not parenting alone, not mobile phones, not a bad day. From a psychiatric perspective, suicide is always a result of multiple interacting factors accumulating over time. Adolescence is a period of neurobiological imbalance. The emotional centers of the brain, that is, the amygdala and the limbic system, they mature earlier. The prefrontal cortex, which controls the judgment, impulse regulation, and long-term thinking, matures later. This means that emotions feel intense, distress feels overwhelming. The ability to see this will pass is biologically limited. This is not immaturity. This is brain development. Many teens who die by suicide are not weak or attention-seeking. Clinically, we often see undiagnosed depression or anxiety, emotional dysregulation, feelings of worthlessness, social withdrawal, sleep disturbances. Importantly, many never receive a diagnosis or treatment. Academic pressure is a risk factor, but it's not the whole story. Academic stress in India is quite real, but science is clear. Stress alone does not cause suicide. It becomes dangerous when combined with perfectionism, fear of failure, conditional self-worth, lack of emotional safety. For some adolescents, one setback feels like everything is over. Family factors are not about good or bad parenting. Risk increases when there is emotional invalidation, high expectations with low emotional support, poor communications, conflict or instability. Many parents are deeply caring but unaware of what their child is experiencing internally. Let us talk about social media and peer dynamics. Social media does not cause suicide, but it can intensify comparison, amplify rejection, create unrealistic standards, reduce real-world connections. For a vulnerable teen, this becomes yet another layer, but not the root cause. One of the most painful realities is this: most adolescents do show warning signs, but they are misunderstood. Changes in sleep, irritability, withdrawal, academic decline, statements like, "I'm tired of everything." These are often dismissed as teenage behavior. Clinically, they are the red flags. Suicide is not a choice, it is a crisis. From a psychiatric standpoint, suicide occurs when emotional pain exceeds coping capacity, hope collapses, cognitive narrowing sets in, and at that moment, brain is not thinking rationally. This is why suicide prevention is not about lectures or discipline. It is about early identification and timely intervention. What science tells us clearly is that suicide is preventable, early mental health support works, talking about suicide does not increase the risk, treating depression and anxiety reduces suicide risk. A supportive adult can be life-saving. Teen suicide is not about failure of one student, one parent, one teacher, or one system. It's a public mental health issue that requires awareness, compassion, and science, not blaming. Listening earlier, taking emotional distress seriously, seeking professional help without shame. These steps save lives. If an adolescent is struggling emotionally, early psychiatric support is not an overreaction, it is protection.